where can we provide a space for women to have actual conversations about their bodies
Yeah.
without shame, without judgment, with the utmost compassion and quality of healthcare, because that's what she deserves, without shoving a certain agenda down her throat and saying, this is what I think is best for you.
Yeah.
It's really about partnering with her and saying, let's figure this out together. And I'm not going to just write you a prescription and send you out the door without informed consent.
Yeah. Hello and welcome to this episode of the Natural Womanhood Podcast. My name is Grace Emily Stark. I'm your host and the editor-in-chief of Natural Womanhood. I'm so excited to be here today with my friend, Helen Nguyen, who runs 3W Medical Clinic in Seattle, Washington. I really wanted to bring Helen on today because I think what she is doing with 3W in Seattle is a true paradigm shift for women's health. So I introduce her to everybody that I encounter in the authentic women's health space. One of the questions I often end up asking them invariably is, do you know Helen Nguyen? And if you don't, why not? Because everybody needs to know about her and what she's doing. And so without further ado, Helen, thanks for being on. Can you please introduce yourself a little bit to our audience?
Yeah, thank you, Grace, for that very kind introduction. I always feel like I'm in the presence of someone much cooler than me, Grace Stark, who I ran across getting to know you so randomly, right? Just reading this beautiful article that you've written. I mean, you've written a plethora of things, but this one article about just the natural approach to fertility and reproduction that caught my eye in Verily magazine and a bunch of other platforms that you've written for. And I was like, who is this person and how do I get her on my podcast? And that's how I have fangirled over you through the years, because your ability to communicate what I do on a daily basis in such an eloquent way, because I am not eloquent by the least. And so I have like, I'm just so grateful that there's your voice in the work that we do, because I guarantee you, your ability to communicate what we do is like, it impacts a lot more than you think. I think you totally underplay what you do, at Natural Womanhood and the ability to communicate. So thank you for having me on today.
I love the mutual fangirling going on right now. It's amazing.
Yes.
We're just gonna hype each other up before we dive into this
Absolutely.
episode.
Shouldn't we do that every day? I should have Grace. I just call you in the morning when I'm getting ready.
I
Just
could
be like,
use that. My daily affirmations from Helen. Yeah,
yes.
I like that.
Yeah. Yes. Yes, absolutely. Anytime. So, as Grace said, I'm born and raised in Seattle, Washington. I'm a native here all my life, never left. Didn't think that was going to be the case, but here I am. I belong to a ginormous Vietnamese family out here. We're the original. My family is the original boat people from the war, and we landed here, and we've been here ever since. And my background is hilariously going into college thinking I'm gonna be something in medicine, and then really realizing I don't want to do anything in medicine. I want to go the completely opposite direction and not be a Vietnamese stereotype and go into medicine. And so I fought that tooth and nail and actually got a BA in women's studies and a master's in social work. And through that process of like really understanding what I wanted to do and how to give back to my community, specifically the Vietnamese community, and getting them the help that I felt like my family received when we landed here has given me the opportunity to sit in these seats and be a voice at the table because of the sacrifices of my parents and grandparents and stuff like that. So I really wanted to do that for the Vietnamese community. Well, just, you make plans and God laughs, right? And so ended up in medicine, but thank goodness, the admin side, because your
Yeah.
girl do not want me to be prescribing anything or diagnosing anything. I could barely do that for myself. So my friend and I started this nonprofit when I was just finishing up my master's. Melanie Gibbs, who's now in Coeur d'Alene, Idaho, with her beautiful family. We felt this deep, deep calling and desire to enter into women's health and raising this big red flag of like women health out here is horrible and no one's talking about it. No one wants to address it. No one wants to take the time to really um kind of address the big elephant in the room of like medicine is going in a direction that is hurting women and what are these Melanie was 21, 22 at the time. I was 24 and we're like we know what we want and we
Just young
know
enough to still
yeah,
feel like you could
we just
take
know
on the
every
world. Yeah.
yeah, we know everything and this is what we want. And so
I love it.
yeah, I'm 37 now and I know nothing. So my 20 something year old
The
self
difference that,
oh yeah,
13 years makes. Yeah.
yeah, yeah. The my thank goodness for the naiveness of
Yeah.
my youth that kind of snowballed into this nonprofit of women's health. We're really trying to do something different against the current out here in Seattle, which is very hard to do. But it has been a blast. It has been like, wow, didn't never in a million years thought I would be doing this. And
Yeah.
having the ability to speak into something that I really feel like I was born to do. So yeah, that's kind of me in a nutshell.
I love that. And I didn't realize that your roots in Seattle went so deep. It's funny, I guess I don't really think of like big cities for some reason as being a place where people like have roots, which I don't know, maybe that's just my weird like worldview. But like hearing that you're a native to there and your family came over there and you've been there all this time and that you stayed and you're still like building up the community there. I think that's really cool because and it reframes kind of the way that I tend to think of like big cities.
Yeah.
That's super
Yeah.
cool.
Thanks. Yeah.
Yeah. So what does, let's just dive right into it. What makes 3W different? What are you guys doing that is paradigm shifting in the
Yeah.
world of women's health?
Yeah, like I mentioned earlier, this work really came out of a personal necessity. Um, Melanie and I were very young, but we encountered situations in our personal lives and our friends' lives, our friends' experiences with healthcare on campus, on the UW, University of Washington campus. There's this little clinic on there called Hull Health, and that's where all the students went for their one free quarterly free exam. And we used to like save it up until you're like on your deathbed to go because no one wants to go. First of
Yeah.
all,
Yeah.
because the care wasn't great, but it was
Yeah.
free. So we were
Yeah.
just like, okay, just suck it up and go. And we just came to a point where the care was so bad
Hmm.
um, that we both kind of looked at each other and was like, there's got to be something better than this
Yeah.
within reach.
Yeah.
We live in one of the wealthiest cities in the nation. University of Washington, UW, is known to have one of the best healthcare in the nation, and yet we were treated very subpar. Whether that's because we were students at the time, whether it's because we were not very good advocates for our own healthcare, you just didn't know what you didn't know being
Yeah.
20 something. And not knowing how to navigate the whole medical system. And it was very intimidating. It was very um, cookie cutter. There was no room for individualized care like they were marketing it to be. And as women, I just felt this really deep desire to create something new, create a new conversation around women's healthcare. And that was kind of the conception of our corporate organization, which is Women's Accessible Medical Services. That's kind of our overarching
Mm-hmm.
parent organization. And then from that parent organization it came about 3W Medical for Women. And we're located just blocks away from the largest university in Washington state. And just to give you a quick landscape of kind of why we chose this space and why we felt very passionate about being here in the middle of the city, surrounded by major hospitals and major universities, but
Mm-hmm.
having access to young people.
Yeah.
So we did 3 years of research before this place even opened and really took our time to understand what are the gaps that our community is feeling within healthcare. And
Mm-hmm.
what we realize is that through our research, the age group of young adults from age 18 to 25, which is kind of our sweet spot of
Yeah.
where our patient population, they live in this zip code. And so we're
Mm-hmm.
like, okay, this is where we want to be. Even when they've graduated or become professionals in the kind of professional world, they still kind of live in this vicinity. And
Yeah.
so we were like, okay, we want to create something here in the heart and what we realized as we were trying to understand the community we were called to serve is that in a 20-mile radius of where I'm located right now, there are 8 abortion clinics, including the University of Washington. Okay. And so when we realized that, we kind of took a step back and was like, okay, we did not know there was that many. And secondly, if you think about women's choice and the options they have with reproductive health care, why is there only one choice being presented to
Yeah.
them
Yeah.
as the go-to place, the most accessible place,
Yeah.
all of that? So,
Yeah.
like it was like we were funneled into going to these other places versus
Yeah.
when I remember, a dear friend of mine being sexually assaulted on campus and not knowing
Oof.
where to go. And she was like, I don't want to go to an abortion clinic. I don't even know if I'm pregnant yet. So where am I supposed to go?
Yeah.
And it kind of organically come of these very um, out of necessity type of conversations with
Yeah.
women in my
Yeah.
community that was like, where am I supposed to send you? Where am I supposed to let you go? Where would I recommend
Yeah.
you to go for women's health care? I can't do it on campus because it's bad healthcare, quite
Yeah.
frankly.
Yeah.
They don't listen to you. You have 15 minutes. It's free and it's like go 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 go.
Yeah.
And
Yeah.
where is there really a voice for women's healthcare? Even
Yeah.
even like for me, I wasn't sexually assaulted on campus, but I had like really bad periods and heavy bleeding and I would faint on
Right.
campus. And the first thing that out of necessity, go to that free clinic, the first thing they would say was, well, are you on birth control? And I was like,
Yeah.
okay, well, I know my body. There's something going on.
Right.
I don't know if a pill is going to fix this. I,
Yeah.
I would like a little bit more of a conversation to get down to the root problem. None of that was being had. And
No.
so 3W was really birth of where can we provide a space for women to have actual conversations about their bodies without
Yeah.
shame, without judgment, with the utmost compassion and quality of healthcare, because that's what
Hmm.
she deserves,
Right.
um, without shoving a certain agenda down her throat and
Yeah.
saying, this is what I think is best for you. It's
Yeah.
really about partnering with her and saying, let's figure this out together. And I'm not going to just write you a prescription and send you out the door
Yeah.
without informed consent.
Yeah.
Um, and so we've stepped into this space of what I like to say, reclaiming what women's healthcare should look like, which is unrushed care, individualized care. You're not this individual that's walking in and we're going to give you a cookie cutter diagnosis. We want to talk about your well woman exam. I mean, how many times have we gone to a well woman exam and it's a horrible experience? Like you hear that all the time.
Yeah.
You hear that all the time, right? So um we really were like, how do we change that narrative? How do we embrace our periods and our fertility as something good?
Yeah.
And that's kind of the space that we've created with 3W. So we do well woman exams, we do STI testing for both men and women, we do the plethora of pregnancy, like ultrasound pregnancy testing, all of that stuff. But we also do, we lean heavily on body literacy in the sense of we want to empower you to know about your cycle and what your body is trying to tell you. Do you know you have two, fallopian tubes? Like, all those things that we
Yep.
should know in
Yeah.
sex ed that we are not being taught.
Yeah.
Um, and we thought we were coming into doing this work from a very narrow scope.
Hmm.
And it has been like, no, I need you to potentially look into perimenopausal care or like infertility
Yeah.
care or maybe incorporating some primary care in that. That's all kind of like on the table for us right now to
Hmm.
explore, but it has really stretched us into other areas that our community is coming to us and saying, I need someone to talk to about my hormone imbalance. Like, how do I
Hmm.
even approach about that?
Hmm.
Um, and so Melanie and I thought very small, which is hilarious. And then now it's just like boomed into something bigger. And it's just a really cool space to occupy here in
Hmm.
Seattle. Um, yeah, so that's kind of like I feel like we came into this kind of really hyper focusing on pregnancy care,
Hmm.
um, and then have expanded into all these other pieces, and that has been extremely rewarding for us, but also for the community, and really trying to reach women from all stages of their lives. Um,
So how many patients are you seeing a month?
well, it varies, but we our schedule has really connected to the school schedule. So summers are always a little lighter, and then it picks up in the
Yeah.
fall
Yeah.
or right after a holiday. We get a
Yeah.
ton of patients right after a holiday. So it ranges anywhere between 70 to 100 to 150 patients a month, depending how long the month is or something
Hmm.
like that. We're open from 9 to 5, and so every hour we see a patient right now. Um, and we're hoping to expand into like evening times. We
Hmm.
experimented with opening once a month on a Saturday from 9 to 2. That's been really popular.
I
So we're
bet.
probably,
Yeah, with
so we're
college
gonna
students for
probably,
sure.
yeah, we're probably gonna start amping that up.
Hmm.
We're in a really fun season right now where we're bringing on, I want to say, three more clinicians to our team to
Amazing.
really expand our hours and our reach because there's
Hmm.
a demand there. Um,
Incredible.
but you and I know the industry that we're in is it's extremely difficult to find this niche medical provider that
Yeah.
understands what we're trying to do and executing it in a way that is honoring of the human body and of the human person.
Yeah.
Um, that is really hard to do.
Yeah,
But
it is.
yeah, and it's just hiring in our industry is just really hard. But suddenly this year, I'm not having to advertise as much in the sense of recruitment.
Hmm.
Medical professionals are coming to us and saying, "How do I be a
Wow.
part of your team? How do I be a part of this conversation that you're trying to communicate to the community? I want that because it feels very life-giving." And
Amazing.
yeah, so I'm just like, okay, now I just have to find the money to pay them to do that. But
Yeah, that's a
you
whole
know,
other piece,
oh
right?
yeah, yeah, being a non-profit is no joke. Um,
Yeah.
so
Okay. Yeah.
yeah,
Well, good luck.
yeah,
And I do mean that.
yes, thanks, yes, yeah.
So, why do you think you have all of these healthcare professionals who suddenly are like beating down your door? Like, what do they see practicing at a clinic like 3W? How do they see that being different from where they are currently practicing or where else they could be practicing, especially in the women's health space? Like,
Yeah,
what's
I
appealing to them?
I think medicine as a whole, like big corporate medical
Hmm.
spaces,
Hmm.
I think when you are being expected to see 50 to 60 patients a day on top of charting, on top of doing everything else that you have to do as a clinician. I think people are tired of that. I think people are
Yeah.
done with that.
Yeah, the
I think,
burnout's real.
oh yeah. And I think that specifically these individuals that are coming to us for an opportunity to join our staff, they didn't go into medicine like being a drug mule. They didn't go into medicine. That's what
Yeah.
they feel like. They
Yeah.
just feel like people come to them and say, I need a prescription for this. Thanks. Or the other way around, in the sense of, here's a prescription after 15 minutes of talking to you. Good
Yeah.
luck. And I'll see
Yeah.
you maybe in 3 months if there's
Mm-hmm.
even a follow-up.
Mm-hmm.
Um, the clinicians that we're experiencing, they're like, we didn't go into medicine harming, wanting to harm people. We want to heal
Right.
people. We want to walk alongside the individuals and really get down to the root problem of why these issues are rearing their ugly head right now, or
Mm-hmm.
what can we prevent? What can we do in prevention um, to address your insulin resistance so that you don't have diabetes when you're in your 50s, like
Yeah.
things like that. And
Yeah. And maybe take care of your PCOS
yeah,
without birth
yeah,
control.
yes, yes, because you are showing signs of all these things and
Mm-hmm.
no one wants to touch you. No one wants to fully diagnose you because they don't really understand.
Yeah.
Talking about PCOS, like I have PCOS and it took five clinicians, five clinicians for me to push, 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 push because I'm Asian and I don't have the normal PCOS
Yeah.
signs, like
Right.
facial hair or something like that, right? And so
Yeah.
I was like, I think I have PCOS, or I think I have like PCOS is a spectrum. So it's kind of like just because I didn't fit this mold
Yeah. Right.
of what normal PCOS patients look like, I was never diagnosed. And it wasn't until I was like, no, you guys are not looking at all these other markers.
Mm-hmm.
Um, so that was kind of like this personal thing for me, but there are so many patients out there that are being misinformed, if not informed at all, about their health, and these clinicians are like, I don't want to add to that. I don't want to be a part of that any longer. I want to be a part of an organization that have unrushed care, really see the person and honor the journey that they're on within their healthcare in this moment in time. And if we can relieve that in any way, fantastic. Um, we remove all barriers to a patient coming to 3W. So we don't take insurance. We don't ask you to have like this ton of money to be able to be served. Like we serve homeless women, So if she doesn't have any money to take care of herself, should she be denied healthcare? Like, so, we work with our patients because we do charge for our lab fees, but
Mm-hmm.
there's a sliding scale kind of mentality. And it
Mm-hmm.
is a candid conversation in private, between you and your physician at that moment and saying, I really need this test, but I can't afford it. And
Yeah.
99% of the time, my clinicians are like, I affirm that you need this testing.
Mm-hmm.
And what can you pay today?
Yeah.
What can you pay? Is it $5? Fantastic. Let's get it done.
That's
Um,
amazing because you can't ever have a financial conversation in any, like almost any clinic setting unless it's
yeah,
cash pay,
exactly.
where you're just like in the dark. Like, okay, I guess I'll consent to having that test and I'll wait 3 months until insurance wrangles with you and then be
Yeah.
blindsided on the other side of that, I guess.
Right. Right.
So, oh
So
my gosh.
we've removed all of that and just really like the woman that can pay and the woman that can't pay, don't they deserve the same type of health care, right? So like all of that has been these barriers that we felt have prevented women from accessing really good health care that they deserve to have, and they deserve to have answers to whatever it is that they're dealing with, whatever it is that they're suffering with. And so these clinicians, I think, are seeing that. We also are an accredited organization or clinic through AAAHC, which is the Accreditation Association for Ambulatory Healthcare. And so we get surveyed very similar to major hospitals what they usually go through is called joint commission.
Yeah.
Since
Right.
our scope is so much smaller, we don't have a
Yeah.
surgical center or anything like that.
Someday.
Yeah, maybe. Girl can dream. Um, my husband will kill me, but and my board actually. But we get surveyed every 3 years from an independent organization that we pay to come in and pretty much blow through every single detail, every single policy and procedure. Like they go through it with a fine-tooth comb, and it is in the spirit of like, are we operating at the highest caliber of healthcare?
Hmm.
Are we up to date with all of what we're telling our patients? Are all of our policies and procedures in place to really provide a safe place for our patients to walk through and getting the best care? And that is so it's every 3 years, but every time we go through it, it's like you literally take everything thing off the shelf, or everything not off the
Yeah.
shelf, that's so old school, everything's digital now, but everything everything
Yeah.
out, and you look at it and you're like, okay, what are ways that we can improve,
Yeah.
and what are ways that we can get our ducks in a row and make sure that our clinicians are credentialed the right way, are all of our nonprofit bylaws are in the correct thing,
Hmm.
communicating what we do and walking the walk and not getting in trouble with the state. Like, the red tape around medicine these days is insane.
Yeah.
And we have passed survey 2 times now. We've never failed. And I want to say this next time that we're going into the survey, which is in September, we're pretty confident that we'll make it out as well. And that's like, that is the gold star.
Hmm.
That you're not just hearing it from me because I'm like one of the founders and I think we're awesome.
Yeah. Right.
There's an unbiased organization out there, that we, quite frankly, do not have to do. We don't have to be surveyed. We don't
Mm.
have to invite people in to our doors and say, look at what's under the hood.
But y'all hold yourselves to that higher
Yes,
standard.
absolutely. So,
Yeah.
like, the state can come in, like WISHA or King County Board of Health can come in and look at any of our books and know that it's up to par, know that it's
Hmm.
like nicely buttoned up. And then we invited a national organization to do this. So we really feel like every day that we're operating is, it's messy, but at the end of the day, if you really want to look at the guardrails in which we put up, it's
Yeah.
it's 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 pretty good, and I can go toe to
So
toe.
you
Yeah.
don't rush women through appointments, and the clinicians actually are there because they want to be, because they care about women and care
Yeah.
about serving them.
Yeah.
Um, you hold yourselves to the highest standard of accreditation possible for your kind of clinic. Um, Really, like, it's a no-brainer how you guys have won. What is it? Best Seattle Women's Health
Yeah.
Clinic for 2 years
Yeah. Yeah.
running
The
now.
Yes, we want, which was wild because I thought it was a scam. Um, yeah, they kept on trying, like 2 years ago, they kept on trying to like get a hold of me. And those things where it's like, you've won, and now we're gonna sell you all these things to get you to advertise with us. And I was
Yeah.
like,
Here's
okay,
your big
guys.
blank fake check.
Yeah, like, okay, guys. Like, thank you. No, thank you. I don't have the budget for that. Like, I'll pat myself in the back, but you don't need to do. And they kept calling us for a month. They kept calling me for a month because, like, we had to go through this, like, award ceremony kind of thing.
Uh-huh.
And finally, I was like, look, I don't have money. I don't have money to give you. They're like, no, it's a free thing. Just take it, please. And I was like,
That is so
oh,
funny.
I, yeah, it was the Seattle Times. You
Yeah.
can't, unfortunately, you can't just like roll over and be like, thank you. I trust everything you say.
Yeah.
Um, I'm such a skeptic on those kinds of things. So we won Seattle the best in the Pacific Northwest women's clinic 2 years in a row,
Oh my
2023,
God.
2024. Second time, I also thought, all right, you know what? Maybe we'll get bronze this year. That was kind of like maybe. And then we won it again this year. And she goes, Helen, it's not a joke. You really want gold again this year. And I was like, okay, thank you. Uh, and we did go to like the party for it. It was like legit. Um,
Amazing.
so it's our tiny little thing, guys. Like our tiny, tiny, tiny little clinic in the middle of Seattle, where people can go in a million directions. Um, we got best women's clinic in the Pacific Northwest. Hey, I'll take it.
Yeah, and they're choosing y'all because they're like you said, there are 8 different, abortion providing clinics in your same area. And that is one of the services that 3W does not provide, right?
Correct.
So let's get into that. What services don't y'all provide? Why
Hmm.
don't you? Um, and what, if any, kind of like are patients surprised when they come in and find that out? Do you have any pushback? What does that look like? How do you navigate that? And just why do you do things the way that you do them on that front?
Yeah, so the two major um, services that we don't provide that sometimes get us in a little bit more spotlight than I like
Hmm.
is abortion and contraception.
Hmm.
And in my opinion, those two things are not health. It's not healthcare. Um, it's elective care that's out there and accessible. You can throw a rock around here, right, and hit someone that would give
Literally,
you.
if there's 8, yeah,
Yes, yes. And
yeah,
that's not even counting the organizations that will send you the abortion pill.
yeah,
That's kind of like come up from the Pacific Northwest.
yeah, yeah,
So access to abortion, you don't need a referral. You can just walk in, right? And
yeah.
now there are organizations that will pay for you to do that. If not, government funding will pay for it. Like we are a sanctuary state out here in Washington,
Hmm.
and our former governor made it so accessible in the sense of he will use our tax dollars to fly you in from a red state to get your abortion and fly you back home. That was
Wow, I
that
didn't
was
realize
his
that.
guarantee.
Wow.
He also took $1 million of state funding for um, this funding was allocated for those that were in prison for healthcare. He took $1 million of that and hoarded $1 million worth of abortion pills to be handed out like candy. Um, our college campuses right
Wow.
now is getting ready to provide the abortion pill in vending machines and in clinics. And being, like I said, very, very, very accessible because Plan B right now on the UW campus has 3 vending machines on campus that you can
Yeah, I
access.
knew that. I didn't realize they were also looking to make abortion pill vending machines.
Yes, there's a new bill that's going to be passed this year for sure. That you can have access to it. There was this whole campaign, and I can send it to you that you can read about it. That and it's gonna pass, and it's gonna pass. So I just know that these things are gonna go through, and and I want to be very sensitive to the topic of abortion. It is very taboo. It's very politically divisive
Hmm.
and charged. I want to say that our organization from the very beginning has been extremely prudent and intentional about talking about this topic because it impacts so many women in our community. And we're not in a position of like, we're not one of those clinics that refuse to talk about it, that refuse to
Hmm.
acknowledge it, refuse to even touch it with the 10-foot pole. We want to talk about it with you.
Yeah.
From the research that we did before we even opened, and this is old stats, but 40% of women in our community did not even know what an abortion entails.
I believe that. Yeah.
So if this
Women don't know
is
what their entire menstrual cycle
yes,
entails. They think you're just
yes,
talking about a period, and they're like, "Yeah,
yes,
of course I know
yes,
about that."
yeah,
Yeah, so I 100% believe that statistic. I'm surprised it's not higher than 40%.
sure it's higher now. I mean,
Yeah.
like this was like years ago that we pulled
Yeah.
the stats. And so when we looked at those numbers and realize like you get more informed consent from getting a hip replacement, a wisdom tooth being pulled, like anything other
Yeah.
than abortion is being
Yeah.
talked about in an extensive way that really really puts it in the hands of the patients and say, at the end of the day, you get to decide if you want to do this or
Yeah.
not. We're
Yeah.
not going to coerce you. We don't benefit anything from it. No one's getting a kickback from it. Okay. So all of those things are happening though. These
Yeah.
abortion clinics are not free. You
Yeah.
have to pay something. Your average
Yeah.
abortion here in Washington state is $700 and it just gets more expensive as you um
Whoa.
yeah, it's gone
That
up from
would be
400.
surgical, right? I
Yes.
imagine.
Yeah.
Yeah.
And it just goes up from there as you become further along. So
Yeah.
um so if if there's an incentive from these abortion facilities to sell you a service that makes them revenue, they're going to sell that service. They're going to, uh, in some ways, convince you that that's what you need because they get a kickback,
Right. And so
monetary
no matter
kickback.
where you stand on like the ideological divide of whether having access to abortion is a good or a bad thing, like wouldn't you still at least want to know that you're going somewhere where you can talk through your options and there isn't some kind of ulterior motive to
Yes.
direct you any one way or another, a financially motivated motive to
Right.
direct you any one way or another?
Right. Yeah, one of our mottos right now is we don't make money off of your reproductive decisions. So we don't have any skin in the game of trying to sway you to do what you don't want to do, what your gut is trying to tell you to not do. And
Yeah.
so we practice medicine. We do not get into the whole pro-life, pro-choice argument.
Hmm.
Um, we lean on evidence-based medicine. What is medicine trying to tell us? What is the textbook biology kind of, type of um, tried and true uh, kind of information that any clinician should be giving to you,
Yeah.
if they don't have an agenda, that you deserve as a patient to
Yeah.
to have. And so if you come to 3W, we will talk about abortion until you're blue in the face, until you don't want to know about it anymore. But
Yeah.
we believe that in order to, if you're going to go and have this procedure or take this medication, you need to know how it's going to affect your body in that moment and
Yeah.
beyond.
Yeah.
And that's where we sit.
Gosh, the thing that really strikes me is I bet that a woman who comes into you and talks with you about the possibility of an abortion, who would ultimately then go and have an abortion, probably has a lot more informed consent about that abortion than if they just went to Planned Parenthood in the first place. Like that's that kind of strikes me as something really kind of fascinating because yeah, we do know that especially in the whole realm of what is, typically considered women's health, which comes down to birth control and abortion, women don't have informed consent, like by and large, about either of these things. And I think it's even worse on the abortion pill side of things because now in most places you don't even have to encounter a clinician at all to get one and
I
take it.
mean, yeah, just last week we had a patient call thinking we were Planned Parenthood
Hmm.
saying, "Hey, you guys sent me the abortion pill, but there are no instructions. There's nothing other than the pills. Can you tell me when I should take this?" And we had to tell her on the phone, we're really sorry, we're not Planned Parenthood, but if you'd like to know more about the medication you just received in the mail 2 days ago, we would love to talk about it with you. Love to talk about it with you. It is, in my opinion, malpractice.
Yeah, yeah.
Like,
I,
how can you send people medication in the freaking mail without any freaking instructions on when to take it, how to prep for it, what's going to happen afterwards? Who do you call after, after your abortion is complete? How do you know your abortion is complete?
yeah, that's
Um,
a big one.
yeah, like we have had, so, there's, we're not in the business of trying to hold you hostage in one of our clinical
Yeah,
exam rooms
yeah,
when you decide to have an abortion. That is between you and your conscience. Our position is, did you know what you were getting yourself into? That's our
yeah,
job.
yeah.
And if you decide to go and do that, which many of our patients do, we want you to know that you can come back and ask more questions. Like
Do they
that's
come back?
absolutely.
That,
Absolutely.
yeah, that's
Absolutely.
such a marker of the level of trust that they feel, I
Yes.
think.
Yeah.
And just like that they know they'll be offered the truth.
Yeah.
That says a lot.
Absolutely. Absolutely. Because what they've experienced from my clinicians is actual compassionate answers to their not dumb questions. They should
Right.
they should be able
Yeah.
to ask as many questions as possible. And it's our position to say these are the pros and cons. You get to
Mm-hmm.
decide at the end of the day. We have free will.
Mm-hmm.
And it's you know your body best. We just want to lay out the is this what you really want to do? Who is we ask the hard questions of like, okay, what happens if you carry this child to term? Who is your support system? Can we be that support system for you if you need it? If you trust us, um, can we connect you with the hundreds, if not thousands, of other nonprofits out there that will provide the crib, provide the diapers, provide the support, the emotional support, the social worker, the transportation. It is an endless list of
Yeah.
people out there
Yeah.
that will drop everything to do that for you.
Which are
Or
a lot harder to find, arguably, than an abortion clinic, especially where you're
yeah,
located. So I could,
yeah.
somebody would push back and say, well, you wouldn't refer them to an abortion clinic, right? So what are you doing? You can't say that you're unbiased. It's like,
Well, I
well,
can't refer my patients to an abortion clinic because I don't know any good ones. I don't know any good abortionists. I've never encountered one.
yeah.
Never. I mean, I'm speaking from a very privileged position of I've never needed one. And when I've had friends and family that has come to me and asked me for my opinion because I'm quote unquote in medicine, in the world of medicine, and
Yeah.
asked where can I go to get a good abortion? I don't know how to answer that question.
Yeah.
Referrals are supposed to be, from what I understand, when
Hmm.
clinicians refer for
Hmm.
a service that for an issue or a surgery or some for a second opinion for their patient, they have a relationship
Yeah.
with the person that they're referring you to.
Yeah. Yeah. That's how it's supposed to work, right? Yeah.
Yes. And first of all, you don't need a referral for an abortion. Second of all, I wouldn't know where to send you.
Yeah. Yeah.
I haven't encountered a good place.
Yeah.
Sorry. Like that's kind of how I answer that question.
Yeah.
And you asked about how patients have responded to us not providing those services
Yeah.
or anything like that. We've never had an encounter with a patient that said, I'm so upset with you for not providing me with those services. First of all,
Hmm.
if you go to our website, we're extremely transparent, if not to a fault,
I know I
on
have it open right now.
yeah,
You
on
have
what
it
we
right there.
provide and what we don't
Yeah.
provide. So
Yeah.
there's no bait and switch going on. Like
Right.
we will tell you over that we are consistent on what we say over the phone, if not on our brochures, if not on our
Yeah.
website. It's a
Right.
consistent like this is what we do well, this is what we don't do because it's outside of our scope of practice. And as a private nonprofit, we can be picky and choosy with what we can provide and what we don't provide.
Hmm.
What
Yeah.
we feel is good healthcare and what we don't feel is good healthcare.
Yeah.
So our patients, I would like to say, know what they're getting themselves into
Yeah.
before they even step foot in the door. Um, if there is a misunderstanding or if there's, you know, patients that are like, well, I really need just, another month of contraception. Can you write me a quick prescription? Again, we would say, first of all, it's outside. It's not our policy to prescribe that type of medication. And contraception needs ongoing care. We're not primary care, so we can't do ongoing care. My doors close at 5. So if you're having a complication at 11 o'clock at night, you're gonna have to go to the ER.
Yeah.
You're gonna have to encounter other types of care, and I don't think that's good care on my end. I need to be able to see you again. If I'm prescribing you that medication, I want to follow up with you. I'm not gonna pass. We're not gonna pass the buck to another clinician.
Yeah.
So it's just not good care if we step into spaces and services that we can't provide ongoing care for you.
Hmm. That makes
Um,
sense.
so it's a
Yeah.
liability risk for us. Secondly, again, we don't believe that contraception is good health care. It is a band-aid to something much bigger
Hmm.
than what is being portrayed.
Hmm.
Um, and let's do something else. So we have a program called FEM, Fertility Education and Medical Management, that
Hmm.
has super blossomed in this community. So just to give you an idea, my typical Seattleite patient is
Yeah,
like
I'd love to hear this. Yeah.
doing yoga, eating non-GMO chicken.
Hmm.
Like she's trying to live this green, natural lifestyle, and yet she has
Yeah.
an IUD in her, or she's taking the pill. It's inconsistent. It's
Yeah.
inconsistent with the lifestyle she wants for herself.
Yeah.
She
Yeah.
wants the highest good for her body. Her body is her temple, right? And then suddenly she's having to like, well, I guess I should go on these artificial, you
Yeah.
know, stuff to avoid pregnancy or balance out my hormones or not get acne or whatever.
Hmm.
It is crappy healthcare.
Yeah. Yeah.
And so when we say, actually, there's a natural green sex, green way, organic way of regulating your periods and really understanding what your period's trying to tell you and honoring what your menstruation is trying to tell you. There's a natural way of doing that. I mean, our patients love it.
Yeah.
They love it.
Yeah, and especially because, like you said, it is a more authentic choice to make based on the other ways they profess they want to live. And so,
Yes.
with that 18 to 25 demographic, especially, like they crave authenticity, they crave
Yes.
that. And when you can point out, like, you say you want these things, but look at what you're doing that is not conducive to that. And here I have something that's conducive to the way that you want to live your life. Yeah, it's no surprise to me that that age demographic in particular is jumping at it when they're just given the information, right?
Yes. Yes. And it's information that they should have obtained the minute they started their periods.
Oh, or before, right?
Yes.
Ideally,
Sure. Yeah.
yeah.
Even before. That's a great
That's
point.
our period genius program. Plug for
Yes.
that. Yeah.
Do the period genius program, guys. I would have I would have like spared myself from so much heartache if I had
Yeah.
these resources at my fingertips, right? And
Yeah.
like these are the kinds of things that I mean, my typical patient is walking in and having repetitive UTIs because she's wiping the wrong way, because she's never been taught to for us to wipe a certain direction to
Yeah.
not continuously get an infection or
Front to back, y'all. Front to back.
yes, yes, yes. And like or like she's douching and she's like
Ugh.
like putting crystals up her vagina to try to cure her bacterial vaginitis. And I'm just like, first of all, please don't do that. That sounds painful.
Yeah.
Secondly, leave her alone. I'm always like, she's a self-cleaning oven. Your girl does not need that much. Leave her alone. And these are the kinds of things that I wish that we should be shouting from the rooftops. Like, and your cycles, like there are moments where she's like more moist or more dry or like all of that stuff, and those things are all normal, and yet we're trying to regulate it. We're trying to control it. And and maybe it's for purposes of like we weren't taught, or maybe it's for purposes of like we are encountering we are in a unhealthy relationship with someone that wants us to smell a certain way, to taste a certain way, to look a certain way. Okay, first of all, it's BS. Secondly, we don't have to do that. Like these are the kinds of conversations
Third
where
of
we're
all,
having.
do they actually really want you?
Thank you,
Yeah.
thank you. We had a patient who took our FEM program, got out, so we took her out her IUD, which we do. We took out Nexplanon implants and IUDs, and we had one patient that, well, I have two stories. One patient that took out her IUD, she had gone on campus to try to take out her IUD because she was in a really abusive relationship. And this partner of hers forced her to put in the IUD so she doesn't get pregnant. Well, she finally makes it out of this domestic violence situation pretty much.
Yeah.
Goes to school, says, I would like to take my IUD. They not only refuse her,
Yeah.
but they say you should keep it in because you're going to continue to have sex and we don't want you to get pregnant.
Yeah. Yep.
And all like the whole time she was like, this reminds me of my abuser. The more this has nothing to do with me having sex in the future. This has to do with me having the courage to leave an abusive relationship, and having this IUD in me
Reminds
reminds
me.
me
Yeah.
of the continuous abuse and control that he has over me. I need you to take it out.
Yeah.
They refuse her. So she finds
I have
us,
heard so many stories like this.
right?
People, these are not fringe things. Like this
I
happens.
know. I know. It's like it's one of those moments where I wish like I could go with these women and just be like, "So I'm gonna like bust your bust your kneecap right now if you don't take it out." Like she like what the hell is your problem? So anyway, she comes here before she even finish telling her story of like what this means to her to take it out. The strings were there. My clinician pulls it out. I mean, she bursts out crying and she's like, he no longer has control over me. Like, isn't like it was 5 minutes. That's all it took. 5 minutes to pull it out.
Yeah.
And what is that going to do for her? For her body, for her spirit, for her mental health? Like, it all changed in 5 minutes.
That is so empowering. Oh my
Yeah.
God.
Yeah. And we were just like, yes, girl. Yeah. Like, yes. Who is he? Do we need to destroy him for you? Like all these things were she was like, "Oh my gosh, I love you." And she left this beautiful review on our Google page. And then there was another young woman that
And did she
um
get femme trained? Did she stick around
yeah,
for femme
she
training?
did. She did.
Love
She
it.
signed up for fem training.
Amazing.
There was another fem patient who took out her IUD, was living with her boyfriend, and was just like, you know what? It's just not working out for me. There's just way too much um, side effects that I was willing to experience.
Mm.
It's just not worth it. She just didn't like it anymore. So she pulled it out. This was her coming back and telling us the story. And she was just like, and my boyfriend wanted to have sex with me. And we were like, okay, and she was like, and I told him what I learned from fem. I told him that I'm ovulating and I'm fertile right now. And if he wants to have sex with me, then he needs to be like open to being a dad. Like, what if I get pregnant? And she's recounting this conversation. And
Yeah.
she was like, you know what he told me? He told me that, like, what the heck? I always had access to you. And now you're saying that I have to wait for like a week or whatever. And like, where's your IUD? And she proceeded to tell him that her IUD, the birth control she was on, was like causing her all these other issues. And
Mhm.
she said she had a light bulb moment that she was, first of all, talking to a fool. Second of all, talking to a man that only wanted access to her
Yeah.
whenever he wanted
Yeah.
and did not care about her health, did not care about how the IUD was driving her crazy and making her suicidal, all those things, did not actually love her.
Hmm.
Did not actually love her. And she goes, you know what I did? I kicked him out. And we broke up and I kicked him out of my house. And no man should have access to me like that. And I don't want to be, she was like, I don't want to be in another relationship with a guy that treats me like that because I deserve someone that wants me to be healthy. And literally, Grace, like,
Oh my
I
God.
wanted to be like, you get $1 million. Like,
The best
because
story ever.
isn't that just beautiful? Isn't that female
Yes.
empowerment? Isn't that like reclaiming autonomy over your body and your health and saying you don't get access to something that I know is very sacred,
Yeah.
and beautiful and good. And oh my gosh, I was in a relationship that was not good, that he was
Yeah.
using me for my body.
Yeah.
And there was no I think I didn't say this in the podcast. We're not a religious organization. We are not a religious organization incorporated under the state as a religion. We are a women's health clinic. Yet there is a sense of um, reclaiming of dignity, like
Yeah.
that these patients are experience that I don't think they get anywhere else.
Yeah.
Because those kinds of conversations isn't being had. How can you have that conversation in 15 minutes? You can't.
Right. Well,
Um,
yeah, and the campus clinics, they are contraception mills. Like, let's
mhm,
just call them what they are. Like
mhm,
that's I'm pretty sure that's all they do.
mhm.
And it's just yeah, wow.
Yes. Yeah. Our patients, I mean, the reason why we won Best in Pacific Northwest 2 years in a row, that's because our patients spoke up on our behalf and voted for
Yeah.
us to have that. So that is such affirmation that they're not the ones being pissed off. The people who are upset with us not providing abortion and contraception, They are the ones that have an agenda. They are the ones that have a bias that they want to push down everyone's throat. They are the ones that say, in order to talk about reproductive health, you need to provide X, Y, and Z. That is a
Right.
ridiculous logic.
Right. And they have absolutely no leg to stand upon when access to either of those things is not an issue. We've talked about the vending machines on
Yeah.
campus. We've talked about the
Mhm.
8 different clinics that surround you. Like
Yes.
it's just they have absolutely no leg to stand upon. Like if there's a question of access,
Yes.
it's a question of access to the kind of care you provide because there's one of you.
Yeah. Yeah. I mean, that's the thing. It's like the logic behind saying, okay, you're a women's health clinic, you need to provide X, Y, and Z, or else you're a fake clinic is ridiculous. They are essentially saying, well, McDonald's serve hamburgers. Hamburgers and hot dogs go really well together. So we expect you to also provide hot dogs at McDonald's, or else you're not a real restaurant. I mean, that's the lot. Like that's how I
Yeah.
see it, as when they are
Yeah.
like, you guys are fake, and you guys are not providing good health care, not real, true women's health care. And I was like, you don't get to define that. You don't get to tell my patients what they should or should not encounter. They should be able to make that decision on their
Yeah.
own.
And they're like the McDonald's, and you're like, I don't know, the Whole Foods that you don't have to pay for, the Whole Foods that's not whole paycheck. Like,
Yeah, yeah. So it's been wild. It's been wild. Like the pushback that we get, I feel like we have built pretty strong armor around just who we are, what we do, and we're
yeah,
consistent with it.
yeah,
We stay out of the political side of things. This is medicine. This is not politics.
yeah.
Um,
Well, your why at the end of the day is to provide good medicine. Your
yes.
why isn't like because I want to make sure no woman who walks in the door will ever get an abortion, or no woman who ever walks in the door will ever consider going on contraception. Like your why is supersedes all of that. It's I want to provide good medicine to the women who walk through my front door.
Yeah. That's it.
And that's so powerful.
That's all we want to do. Just let us continue to do it.
Just plugging along.
Yeah. Yeah. So, I mean, it's never a dull moment. It's super fun. It's super honoring. It's a great honor to do what we do. I have a great crew. The people that are part of our organization, they feel a deep, deep passion and desire for women's health, because they've either experienced poor health care themselves, or know of someone, and they're just like, that should never have happened.
Yeah.
We live in one of the wealthiest cities in the whole
Yeah.
freaking country,
Yeah.
and you tell me you can't spend a little bit more time with me telling me about my body?
Yeah. I've been talking and getting to know Dr. Naomi Whitaker a little bit better
Mm.
lately, and her husband Brian. They run the RRM Academy together, the Restorative Reproductive Medicine Academy. Awesome husband and wife duo, and there something listening to them has opened my eyes to is the insane level of trauma that women experience that's inflicted upon them through what we call women's health. Like it's just it's crazy. And so in reckoning with the source of that trauma and trying to really help women heal, like the kind of care that you're offering is doing that. Like I really believe that just in the stories that you've shared. Like these are stories of like healing from trauma.
Yeah.
And they're so
Yeah.
redemptive. Like it's oh gosh, it's
Yeah.
incredible.
Sometimes there are patients that they're coming in for like an STI test or a pregnancy test or something like that. And because we have up to an hour, and we always say, like, if we don't finish this conversation or this appointment today, you can come back tomorrow, or you can give me a call, or we can jump on a telehealth appointment or something like that. That like already like let go of all this pressure to like squeeze in all these questions and answers in that moment.
Yeah.
Secondly, we know that we're our body and our spirit and our mental health is all connected. So we look
Hmm.
at her as this holistic individual, that she might be coming in for potentially one thing, but it's all connected to
Yeah.
maybe decisions, to medication, to lifestyle, all of those things is connected. And so sometimes when in our consult rooms, we like to take our patients into our consult rooms before we take them into an exam room. And our consult rooms it is designed to look like someone's living room. So it looks very comfortable, very like come and just like relax. Let's relax before we get into before we
Let
get
me get to know you
yes.
before I start offering things without
Yeah.
any knowledge of where you are in your life, what you've
Yes.
experienced, what your goals for your future are, the kind
Yes.
of care you hope to be. Like, yeah, it's wild that we otherwise go and just sit on an exam table and the expectation is you're going to give me something with knowing absolutely nothing
Well,
about
sitting
me.
on an exam table in a sterile space, half naked
Is so
sometimes,
vulnerable. The power
right?
differential there
Yeah.
is,
And then there's this
yeah,
person that is supposed to be this like know all about my body in the
yeah,
15 minutes, 10 to 15 minutes we're allocated, and then suddenly write me a prescription and I should be whole again. Like
right.
that is not
Yeah.
honoring of
No,
the
it's not
journey.
medicine.
No,
It's
it's
not,
not medicine. And
yeah.
sometimes like what if you're really anxious or you had a really bad day and now you have to deal with this like ridiculous, UTI that you keep having, or, you just broke up with your boyfriend. And it's like sometimes all our patients want to do is say, yeah, I'm in for this potential STI I might have, but I'm having a really bad day. And literally, my staff will put away the clipboard and say, okay, let's just talk about how the week's going. How are you? What would you like me to know? What do you want out of this appointment?
And these are
Um,
clinicians that are talking
these
to
are
them. These
clinicians.
are
These
not
are
just like volunteers off the street.
no.
Like
I
this,
don't have
yeah.
volunteers uh, connecting with my patients. We've had them in the past, but we've gone much more towards paid staff. First of all, it's honoring to that person that's providing that care. They
Hmm.
should be compensated for their
Yeah.
gifts,
Yeah.
and it just again holds us to a higher standard of
Yeah.
like
Yeah.
you've gone through our training, you've gone through our policies and procedures, and there's a mutual understanding of I can I as CEO can relinquish that responsibility to that
Hmm.
to um to that staff person. So we have medical assistants and clinicians, and our clinicians range from naturopaths, physician assistants to nurse practitioners, as well as OB. And so the conversations that we have in with our patients from what I've witnessed and understand is like, let's just talk about you. We're just going to have this moment to check in mind, body, spirit. How are things going? I know you're in for this, but tell me more. Tell me a little bit more about how you think you might have syphilis, right? And okay, that's I'm or sometimes the conversation is like, okay, do you know where health wise, do you know where you want to be? Um, or my typical patient is about 25, and in the past 6 to 10 months she's had upwards of 10 partners. So there's a story there. There's a story
Yeah.
there.
Yeah.
And she's depressed and she has an eating disorder or she's cutting herself, and it's just like being able to be like, okay, how can we address this so we can address this because
Yeah.
it's interconnected.
Yeah.
And a lot of the times, our patients are like, I don't know why I engaged in that behavior. I don't want to. I'm feeling pressured to. Um, I feel like I have no choice. I
Yeah.
feel like this is the only way that these guys are going to like me. Um, a couple of years ago, I did a whole podcast series on this pattern that we were seeing within our patient population, young women being highly, highly addicted to pornography, consuming porn at high rates,
Hmm.
as much as their male partners. And so I did a podcast series on it, but we were seeing that these young women were trying to keep up with the demands of what they were expected to perform.
Yeah. I believe
And
that.
and because we don't consume porn the way that men do, it's still bad regardless of which gender, but we consume it in a way that is like our bodies are not built to do that. And
Yeah.
so it manifested itself in mental health issues. It manifested itself in physical issues that
Yeah.
would not have presented itself before if
Yeah.
not for the influence of pornography, if not the
Yeah.
influence of sex toys
Yeah.
that they were being pressured to use on their bodies, right? And so, just peeling back those layers of like this issue not only impacts men on a ginormous basis, it is now impacting young women that are
Yeah.
consuming it at a rate that is extremely alarming, that should be like red flag people to our community. And it was like,
And taking performance notes from it.
yes.
Yeah.
And you know, our clinicians were the ones that made me aware of the issue and the pattern that they were seeing. And so I just, that topic is so uncomfortable to talk about, especially for females.
Yeah.
And I was just like, okay, well, we need to talk about it though.
Yeah.
Because the more we don't talk about it, these girls are hurting in silence. And she needs to know that if she doesn't want to, she shouldn't have to. You don't
Yeah.
have to keep up to keep him. You don't have to do any of this. And so many times, it's the first time that these patients are given the space and permission to say it out loud. I don't want to be sleeping with this many people. I don't want to have recurring gonorrhea.
Yeah.
I want to have kids in the next 5 years, and I don't think this is healthy for me.
Yeah.
Okay, I'm honoring what you realize, and I don't dislike you. I don't, your worth to me is the same,
Yeah.
is the same. And I think communicating that, not just through words, but through the way we touch them, the way we care for them, just the way we, like I was really, really anal with how the clinic looked and felt.
Yeah.
I'm such a control freak. Pray for my husband. But just like the chair she sits in, the pillow she's gonna hug, the down to like the cloth napkins that we have, or like the cloth gowns, all those things. It's like, how do we elevate this experience of healthcare that she's receiving? But it is also an extension of our desire to love her,
Yeah.
and that love, I hope, is communicated with the utmost genuine, communication.
This is
So
amazing. This is so great, Helen. I feel like we could just keep going on about this, and it's so empowering to hear that 3W exists and that you do what you do. Um, I'm wondering, like, for listeners, if they're thinking, like, well, how do I find a place like this? Does anything
yeah,
else, to your knowledge, exist like this in the rest of the country?
there are pockets of our nation that has clinics that are very, very similar, if not the same, to 3W. It is very difficult to find, but I feel like there is this like pivotal moment right now in women's healthcare, that is is like, we either get on board and do this, or we will miss a huge opportunity
Yeah,
to
absolutely.
heal people that we care
Yeah,
about,
yeah,
or heal people that we don't care about that we've never met in our life. Like, don't they
yeah.
deserve that too? There are pockets in our, I know there's folks out in North Dakota, there's folks down in Georgia, um, there's folks down in my state specifically. I think because topics like abortion and women's healthcare is so heavily charged here out in the
Hmm.
Pacific Northwest,
Hmm.
that we kind of always have to be on the cusp of like, okay, what are we
Yeah,
doing next?
cutting
And
edge.
pushing
Yeah,
pushing ourselves to get out of our comfort zone of just doing one thing, and constantly reevaluating of like, what is the need of our community and how do we meet that need,
yeah,
even when we don't fully understand it, but we're open and willing to explore it.
yeah,
um, because it is forcing our hand to do that.
yeah,
And then there's this ripple effect across the nation. But the West Coast usually is the first to get hit with something weird, and then
yeah,
we're just
yeah,
like forced to respond to it in a way that
yeah,
doesn't dilute what we're doing, but enhances what we're doing and saying,
Yeah.
okay, this is definitely, this is not mission drift. This is definitely something we want to
Yeah, we can respond.
step into.
Yeah.
Can I show you this flyer that we have on campus?
Yes,
Because it has caused quite a stir sometimes. This is our flyer on campus. We call her Septum Sam. She's super cool. She has tats and a septum piercing, and her
and a happy
sidekick.
little uterus behind
Yeah,
her.
her sidekick is like happy uterus that floats around with her, and she's super cool because she goes to UW, but she also goes to 3W for her healthcare.
So she's the coolest.
Yes, and she knows everything about her reproductive system, and she's doing fem, and her uterus is happy because she's doing fem. And
She's
that
the it girl.
yeah, and she is a counter to what our campus is trying to tell women. I have this so on campus there's a student ran newspaper called the Daily, the UW Daily. It's student ran, it's campus funded, like the school funds it. And every year or every month there's a new issue. But every year in February, because it's Valentine's month, they come out with the sex edition. And the sex edition is always the most popular edition. It's digital and print. And this was in 2023. I don't know if you guys can see it. So the whole front page,
Oh, Playboy bunnies.
yeah, is glorifying
Yeah.
paper bunnies. Right. And this is, like I said, like it will
Super
make
empowering.
your grandma blush kind of situation when you read through all the articles. 3W always has an ad in it because, why not? We should always provide actual choices to women. But there's always this ad. Pay for your tuition, working 1 day a week, no experience necessary. Apply at this like website. And now contracting, entertaining, and hiring all positions. And it's funded by the 6 strip clubs that are in Seattle. That's the culture. That's the message to poor, struggling students who want to have an education on campus is you should strip at night
Sell your body.
to pay for your tuition. So what does that tell, tell the young, women on our campus? What does that tell the men on our campus? Like the young boys on our campus that like, it's not a guy on this ad, it's a girl.
Mm-hmm.
Right. And it just continuously gets worse. Like every edition that comes out. And that's what we're pushing back on. That narrative that you should become a stripper to have a higher education. What?
I love that you guys have an ad in that issue. I think that's so important. I think what you're doing is actually giving women real choice. I hope that anybody who's listening, whether you're a woman who's looking for better care, you're empowered to know that there are clinics like Helen's out there. You don't have to settle for the status quo. And then also if you run some kind of clinic or center and you're wondering what more you can offer to the women in your community, I hope listening to Helen lets you know that like there is a different way. There are ways to move to this model where you're actually just really offering good care, and that's your why at the end of the day, is offering good medicine to the women who walk through your doors. So I hope I'm very heartened by having talked to you, Helen, as I always am.
Oh, thank you.
Thanks again for listening to this episode of the Natural Womanhood Podcast. If you enjoyed it, please drop us a review so other women and couples interested in authentic women's health can more easily find us. Also, please be sure to check us out at naturalwomanhood.org and on our Facebook, Instagram, and X accounts. And if you never want to miss an episode of the Natural Womanhood Podcast or a new Natural Womanhood article, media appearance, or our latest educational content and programming, please be sure to sign up for our newsletter, which can again be found at our website, naturalwomanhood.org. Thanks for sharing a part of your day with us, and we'll see you next time.